In healthcare, there may be no more chilling 3 words than "you have cancer." Those words are associated with death, disease, disability, and horrific treatments. So traumatizing and stressful can those words be, they can send you into a fight or flight reaction, and sometimes even mental paralyzation. If you have heard those 3 words, you may be breaking into a cold sweat right now just thinking about it, and may be familiar with the stressors associated with the early diagnosis period. I welcome you to this conversation. Welcome to the Recovery Room podcast. In this episode, those 3 effing words, we are discussing the early stressors of a cancer diagnosis. We are joined today by licensed clinical social worker, Jeanette Boss. Additionally, Jeanette is a cancer survivor, and she has a cancer diagnosis story with a twist. Whether you are podcast watching or listening, I appreciate you being here. I'm cancer physical therapist, Dr. Leslie Walke. Please hang around until after the show as I'll offer you your episode recap, and you'll learn how you and I can directly engage in my incredible cancer survivor membership group, Recovery Room Plus. This is the Recovery Room podcast, discussing all things cancer recovery, bringing you the accurate information and next steps you need to be healthier, more confident, make better decisions, and live your best life after cancer. Hello, Jeanette. Welcome to the Recovery Room podcast. So glad to have you here.
Thank you so much for having me, Leslie. I'm really looking forward to chatting with you today.
Yeah, this is going to be great. I think when we have therapists who specialize in therapy and counseling for people with a history of cancer, it's always an interesting twist when the therapist themselves has a history of cancer. I think it just, I don't know if it's street cred is the right word. But people really respect, like, this shit, what happened, you've been through it. So I think it just adds a level of, I am comfortable in your care. So I'm excited to talk to you today because today we're talking about really navigating the stress of diagnosis, early testing and setting up your cancer team. So again, it's nice to talk with you. So first of all, just share your cancer history and your little cancer twist, which I think is interesting.
There is a cancer twist. Yeah, thank you. It's such an important topic to talk about. And it does bring some street cred. I definitely, as a therapist, when I speak to my clients, sometimes I say, you can use all the big words with me, right? I've been through it, even if it's not the same cancer.
Yeah. Yep.
So my story, briefly, in 2010, I was diagnosed with papillary thyroid cancer. Well check, no symptoms, which I think can be very common with cancer diagnoses coming out of the blue. You go in for something else, they find it by accident, annual OB appointment, just, I feel something on your thyroid. And that led to, ultrasound biopsy and the diagnosis. And the twist is that I have an identical twin sister. And at the time, our doctor said, "Oh, it's not a familial cancer, no need to test anyone else." But we are identical, braces on the same day, off the same day, wisdom teeth out the same day. There was, there was just something that we decided to push a little bit and say, please just, they felt nothing on her, but please just test. So it turned out that she also had papillary thyroid cancer. So 3 weeks after.
Freaking believable.
I know.
And you guys live in the same city?
We live in the same city.
Wow.
We had the same doctors. We have the same doctors still. And went through the journey just 3 weeks apart. So I had my thyroid taken out, treatment, and she did everything about 3 weeks after me. So we were close enough. We didn't need to have cancer as well. But
things you don't want to share with your sibling, right?
Exactly. So that's the little bit of the twist for me is sharing all of that with my sister.
Yeah. Okay. All right. So there are multiple times throughout a cancer care experience, which can be weeks, months, years long, that are incredibly stressful. Most often for most people, the first most stressful point will be when you hear the words, you have cancer. All right.
Yep.
So, and as you mentioned, some people can really be sick for a while and they don't feel well. They go to the doctor and they find out that's why you feel sick, because you have cancer.
Right.
Or sometimes people are in for an exam for a knee, a preoperative exam for a knee replacement, and they find something, or just a screening test. I mean, there people feel totally normal. Like, what do you mean I have cancer? I feel fine. So either way you enter it, it can be really, really shocking and really surprising. So, so people are thrown into a situation where most people don't work in healthcare. So
Right.
they're thrown into a world where you now have a shocking diagnosis. You may be tossed into a world of scans and tests and language that you don't understand, have never heard before. So you're stressed out, you're going through a lot of stuff, and then you're expected to build a team of physicians that you don't know anything about or may not know anything about. And then you're exposed to make decisions based on all this stuff. So it's a really incredibly difficult time.
Yeah, I often think about that fight or flight response, well, and freeze, which,
Exactly.
yes, where it's, your body is it's the emotions are all over the place after a diagnosis, and everyone experiences it differently, but
Mm-hmm.
probably very common themes of fear and anger
Yep.
and sadness and loss and just the cancer word,
Yep.
right? So, it's one thing. Once you hear the word cancer, I think a lot of people just, they don't even, they tune out, they're
Yep.
frozen, they're stuck. But like you said, now you have to navigate the healthcare system, and there's words you've never heard before. And every cancer is different, right? So
Mm-hmm.
it's, now that we know you have cancer, we now want you to go through, often additional testing to determine
Right.
stage of cancer, to
Yep.
determine,
Subtype.
next
Yep.
steps, all
Yep.
of that.
Yep.
So,
Yep.
I think that, and then it happens quickly too. And so often when people talk to me about that, if you can slow it down, do it, right? You can't always, because sometimes there's situations where right away decisions have to be made.
Yep.
But I think that, yeah, people, you're in shock, you're
Yep.
frozen,
Yep.
it's everything and anything and everything you're feeling on top of each other.
Yep.
And you still have your everyday life stuff going on, right? So whether you're a
Right.
parent or, your
Yes.
partner, you're,
The world
taking
does
care of
not
parents.
stop. Yep. Yep.
No, it doesn't.
So you reminded me of something that I always say is I think one of the first most important questions to ask, and you don't even know what questions to ask most often. And
Exactly.
that's normal. So people feel, I didn't know what to do. I didn't know about this stuff. But you're not supposed to,
No.
so take that burden off your shoulders and just say, of course you're going to be confused and shocked. That's normal. So don't feel bad
Right.
about that. But one of the first most important questions to ask your physician is, how much time do I have to make a decision?
Yep.
In some types of cancers, you may literally have less than 24 hours because you will be
Right.
dead if we don't take action now. So this happens in leukemias and lymphomas very commonly. But there
Right.
are some cancers you literally can take a month or two to step back and decide, okay, what course of action do I want to take? Most
Yep.
people are in the middle. You don't have hours or months. Most people have several days to several weeks. So your cancer, your situation is really important.
Yes.
So ask, how much time is it safe for me to make decisions or talk to other people? And then based on that, then you can really take action steps next. Like, oh, I really do have to get on the ball. Or you know what, I can step back and make more phone calls and stuff. So first important question, how much time do I have to make a decision?
Exactly. And I think then you're now in this world you've never, first of all, never want to be in. No one chooses it. No one
Right.
wants it.
Right.
Right. And like you said, you don't know the words, the language, but okay, so how much time do you have? So that's going to gauge, what decisions you make next. And I think, and I'm sure you've worked with thousands of
Thousands. Yeah.
patients, thousands, right? I think, it's really having, like, how can you come up with all the questions alone, right?
Right.
Like, because, okay, so you have a week, let's say, or you have 48 hours, you have 2 weeks. So now what? What's important to do next, right? Because you're dealing with all these emotions, but now you have to become, an expert in your own situation
Right.
and take reins and ask questions. But you don't know what to ask,
Yep.
right?
Yep.
So, I think, I always recommend, and I've been that person for many people, and I'm assuming you have as well, is have somebody else go with you to the appointments.
Right. Even if they don't know a darn thing.
Yep.
always, if you can, take somebody with you. And if you can't physically take somebody there, because sometimes you can't,
Right.
is now physicians are typically very used to, and you have to ask their permission, but you can literally call somebody on the phone and have it sit there with you. And you just hold it, and you can either FaceTime, or I've even had physicians talk with multiple people, because on smartphones now you can usually three-way call people.
Right.
So you have to get permission to do that, but I don't know a physician that would say no. And then that person can hear, take notes, because it is nice to have somebody just write stuff down for you,
Yes.
have somebody ask questions for you, ask
Yeah.
your, like, what do you want me to, because sometimes it's hard to ask your own questions, like, what's my life expectancy, or what's going to happen. It's hard to ask that about yourself, but somebody else can do it for you.
Right.
That's absolutely okay. So I think, yeah, tip number one would definitely be either bring somebody physically with you, or have somebody on the phone to just listen and write stuff down, because you are probably going to remember 15%
If
of,
that, I agree. Yes.
when you come
Yes.
out of there. So, and again, you may need to make decisions based on what you just learned, or next step. So if somebody is there also to say, well, I heard this, we're going to
Yep.
do this. Or you could say, listen, when we walk out of there, make sure we know what the next steps are, because, at least there's two brains instead of one that's probably functioning on 10% brain power.
Right.
So
Exactly. Yeah.
yeah,
And compare notes and share. Right. Because, right, you're going to get different pieces of it.
yeah,
Your partner, your friend, your colleague, whoever you bring
yeah,
along is going to
yeah,
have they're going to hear different things. That's just
yeah,
how it goes in these
yeah.
very tough
Yep.
conversations.
Yep. And I would
Um,
also recommend to people that if this is a surgeon or a medical oncologist or radiation oncologist, or whoever this is I would say, who in your office can I call if I have a question? Because the doctor's not going to say, hey, it's me, what do you need? They're not going to pick up the phone. So what's the
right.
phone number? Which nurse or tech do I speak to that can get
Right.
information to you if I have a question? Because people always forget to ask that. So that's number one, is find out how much time you have to make a good decision. Number
Yep.
two is get a phone number and a contact person that can get direct questions to that particular physician.
And often, and that's great, and great advice, because I think, as you know, and I know, and everyone knows, navigating the healthcare system, sometimes, we have amazing doctors and nurses and PA, but it's
Yep.
very hard to access them sometimes. And so
Yes.
knowing which number to call, and, it depends on, the clinic, the hospital, the city. There's often nurse navigators assigned in the cancer world, not always, but there's packets given. I've definitely supported people and gone with them to
Mm-hmm.
hear after the diagnosis, the appointment, to gather the information. And there's often a folder given. This is a little
Yep.
bit about your cancer, this is a
Yep.
little bit
Yep.
about what we do here, this is the contact person with questions as well, that
Yep.
that you
Yep.
can ask your questions to.
Yep. Yep. So I'd love to ask you next about, because this kind of relays into the next point. So the next question I would ask while I'm there, if it's the appropriate physician, is where can I go online to get accurate, understandable information on this particular type of cancer? Because for a lot of people will tell new cancer patients is don't even go online, don't look, don't research, because it's just too much, it's overwhelming. And that may be fine. But if you're going to go online, where do I go that's safe and accurate? Because there's a lot, 90% of what's actually online or on YouTube or on Facebook, it's not medically accurate, or it's not science-based or evidence-based. So where do I go? I mean, most cancers will have an official
Right.
website that's done by that group, but you still have to be careful. So I would always ask that question, where can I go to get accurate information?
Yes, I love that. I think that I agree with you, and that's been my experience as well. Is it's very specific to the cancer. So, for
Yep.
example, in
Yep.
my situation, diagnosed with thyroid cancer, um, they shared THICA, which is the Thyroid Cancer Survivors Group. It's a survivors group.
Mhm.
It was incredibly helpful for me.
Yep.
But I think the American Cancer Society has really good,
Yep.
even like after diagnosis, a guide to like what next, like
Yep.
patients and caregivers. What do I do?
Yep.
Um, and then again, it's very specific to each cancer.
Yep. Guys. But cancer.org and
Yeah.
cancer.gov are both, that's the National Cancer Institute and the American Cancer Society. they have specific information on specific types of cancer. So that's a nice first easy place to go. If you want to go somewhere, that's a nice place. So, all right, counselor. So I think the next really tough step, once you get through all the medical stuff, is question number one is, how do you tell people? Mm-hmm. And that's awful. Yes. And then number two, how do you manage their emotional reaction? Or how do you manage when people maybe really knowingly and lovingly say something really stupid?
Right.
So let's start with number one. So how do you tell people?
How do you tell people? And that's,
or how do you choose who to tell? I mean, that's all.
How do you choose who do you tell? That's so
stressful
personal
and heavy.
That's so, how do you? I mean, I think I shared with you at the time, you know, I went through a divorce, and so I was single navigating cancer. So, or, you know, how do you, in that situation, you know, I'm on a date with somebody and I say, hi, you know, nice to meet you. I'm going through cancer treatment right now. funny, not funny, but when do you, right. When do you and how do you decide who to share with? Well, obviously, you know, the people you feel safe telling, and the people in your immediate household and your family that can provide support and love, the people in your village is what I would say. It's really important that they know. And I have a lot of people that ask me, how do I tell my children though? Right. So how do you navigate it with, you know, adults, partners, friends, and children? And what I always say is, you know, you don't have to hold back if you feel like crying. You don't have to, just be real, right? You just found out. You don't have to sugarcoat it. You don't have to explain it. You don't have to know more than you knew the day before about it. Mm-hmm. It's just saying, you know what? I found out yesterday I have cancer. Right. And so with children, I always counsel people on sort of age appropriate ways to explain it to their kids. But I still feel strongly that using the word, again, you know, modifying the descriptions for how old they are. You're not going to tell a 3-year-old, you know, a full name of cancer and what it means. You might explain like, mommy, you know, mommy went to the doctor and I have something called cancer, and there's such great doctors, and I'm going to get some treatment and some help. So there's different ways to explain it to children depending on their age. Mm-hmm. But what about, like you said, when you explain it and now their reaction either feels like a burden or becomes a burden? Because I think people with such a kind heart, and we all have done it, say stupid shit.
Right.
And they don't mean to. They don't mean to. And not only
or just the heaviness. Because I've had people say, I just got exhausted telling people, because I tell them and then they start to cry. You know, then they feel the pain and the shock. And sometimes people are like, oh my God, I'm so sorry. They feel it, but they can compartmentalize and say, what can I do for you? But some people will just fall apart, you know, and all of a sudden you're like, wait a minute, I'm not strong enough to cope with my own situation. I feel like I got to take care of you. So you do have to kind of be careful, or you can, you know, put somebody in charge of saying, listen, can you please call these 5 people or text these 5 people and just tell them for me? Say, I'm sorry. I'm not, you know, you got to be careful. You don't want to offend people, but that's okay to do, is put other people in charge, because do not underappreciate the exhaustion it can create just by telling people. Or like, do you tell your boss? Do you tell, you know, your ex-husband? Do you tell, you know, your parents? If your parents are elderly, do they really, until you know, or maybe you don't, maybe you want to wait till you know more. You know, maybe this is just a surgery and I'm done. Maybe this is just, we're going to watch it for 5 years. Maybe this is like, I have to do chemotherapy, radiation, and surgery. Maybe, you know, do you need to tell your father with Alzheimer's? You know, those are so many decisions that go into all of this stuff.
A lot. And that's a really good point too. I think some people, a lot of people wait depending on who the person is, right? So it's, I need to tell my immediate family, this is important. I'm coming home. They knew I got a call from the doctor, or they knew something, right? But, you know, an elderly parent who's struggling with their own stuff, okay, maybe I'm going to wait till after I find out more information on what this really means. I know I'm diagnosed with cancer, but now I need to know, you know, what does my treatment look like? You know, what's ahead for me? So sometimes people wait. The other thing that sometimes I have clients talk to me about is the burden of the other person's own stress that they should get now tested for that cancer, which is a unique thing that you don't think would happen. But, you know, for example, even my own story, having thyroid cancer, I would notice, when I started feeling comfortable telling people, they're sort of feeling their necks. And yeah, and out of,
Yeah.
right, because you're like, wait a minute, you didn't have any symptoms. You
Right.
didn't know.
Yep.
So
Yep.
then I would get people
It
saying,
scares
should I
people.
ask my doctor about it? Like,
Yep.
should I look into it? And now you're taking on their fears of their own cancer
Right.
when you haven't even navigated your own emotions about it all.
Right. Yeah. Yeah. That's insane. So how do you have any tips and just recommendations on like, okay, surviving between like CT scans or MRIs or just surviving between appointments? Like, how do you go to sleep?
Yeah.
How do you get up in the morning? How do you keep your appetite, keep focused?
Yeah, thanks. That's really an important thing to think about because it's not just, it's those in between, right? It's the waiting
Yep.
for a test result. It's the knowing a scan is coming up
Yep.
or just recovering from, the chemo side effects. It's all of
Yep.
that.
Yep.
The tips I have when, they're the general ones, right? It's dependent on how someone takes care of themselves, but like amp up the self-care, which sounds, of course I'm going to take care of myself, but
Yep. Yep.
amp up the self-care. And what is that? What is self-care? Sometimes self-care is honestly just, for one person, it's reading a book. For another
Yep.
person, it's,
Yep.
a wine Zoom with everyone because you can't
Yep.
leave the house because
Yep.
you're recovering.
Yep.
Someone
Yep.
else,
Yep.
it's, a podcast, it's a bath,
Yep.
it's active exercise if you're feeling up to it. I mean, there's a range of what self-care looks
Yep.
like.
Yep. And I want to point out too, because that's a great point, because you do need to put yourself first, and do those things. Again, self-care can be sitting down and sobbing with a gallon of ice cream. That works. That's okay.
Yes.
What I think it gets difficult for people is like, oh my God, on day one, I have cancer. So on the evening, I'm going to change my diet. I'm going to change the way I'm going to change my cosmetics. I'm going to change this, change this. I mean, that's not helpful. You
Right.
may need to alter some things, but changing, like, I'm never going to drink again. I'm never going to smoke again. I'm never going to eat again. I'm never going to, whatever. That's not healthy at this point. So self-care doesn't mean being perfect with all this other stuff. Self-care means, what do I need to do right now to acknowledge my emotions, to address them, let them out, and then help me regain my energy, whether it is a podcast or hanging out on Zoom with your G's, drinking whatever. That's all fine. I love those suggestions.
Yeah. And I think it's also, right, the whole, you can't go around it, you have to go through it, right?
Exactly. Yeah, that's
and
great.
So if you're feeling like shit and you are stressed and sad and angry and all of the above, and you have a day where you don't leave your bed, it's okay.
It's okay.
Right?
Yep.
It's okay.
Yep.
It's okay to feel what you feel, right? And so you also don't have to have it, like you said, solved and figured out. You don't have to change, your life. Like, you don't have to figure it all out in one night. And like you said, how are you going to get sleep anyways if you're trying to do all of that?
Right.
So,
right.
Letting yourself feel what you feel and really trying to nurture yourself with self-compassion, because I do feel like one of the things that happens after diagnoses with cancer, at least in my experience talking with people about it, is there sometimes is some self-blame and guilt and shame.
Yeah.
Like,
oh, thank you, Jeanette. Yeah. Drop that crap. You don't need that load.
No.
And if it needs to be addressed, deal with it later, but not now. Exactly. Thank you so much for saying that. Yeah. It's like, nobody deserves cancer. Nobody caused their cancer. I don't care what your circumstances are. Even for people with lung cancer, drop the self-blame in the criticism. Right. It's just gotta stop. Yeah. It's not. Yeah. There's no benefit, no necessity that you didn't cause your own cancer. No one deserves cancer. Cancer is never your fault. Yeah. That's
never.
Perfect. So for people who are in this newly diagnosed phase, or if you're listening to this and you know somebody who's just been diagnosed, what are some of your favorite resources that people can go to for support?
Yes. I think, first of all, at a small level, right? Like, use your village. So it's one thing where I say, be not selfish, be selfish, take care of yourself, do that, but also don't keep it all in, right? Because there's a lot to kind of process. So local resources for everyone. First of all, I think everyone in the whole world should have a therapist. That's my personal view on it. Just like preventative going to a doctor, I think it should be just that you have someone you can talk to about life and your stuff. So talking to a therapist, I think, is extremely important. In terms of favorite resources that anyone can access, and I think is extremely important, there's two One, Immerman Angels is an organization that provides one-to-one cancer support for not only people navigating cancer, but also caregivers.
Mm-hmm.
And they match you with someone that has a similar stage cancer, a similar type cancer globally.
Yep.
And an angel, they call them, or us, because I'm actually one as well, will reach out to you. And now you can ask the questions. Well, what did you like? Explain what this blood test means. Like,
Yeah.
how did
Yep.
you deal with
Yep.
this? So it's a beautiful free resource.
Yep, free is the key word. And I've met Johnny Immerman actually developed this. Johnny is a great, I just love Johnny. He's a great guy. He is a stage 4 testicular cancer survivor. And again, went through this as a young person. Is like, this is crappy. What can I do? So he created this spectacular resource. So Immerman Angels is a fantastic place to go. All right, what's your number 2 resource?
My number 2, and not in order, because this is
right.
ABCD. So after breast cancer diagnosis, it's
Yep.
it's a different organization run. It's an amazing organization, obviously specific to breast cancer, women, women and men.
Mm-hmm.
And again, a very trained mentor will connect with you once you reach out. And I strongly suggest to people with, breast cancer to connect with this agency immediately, because even talking through that feeling of shock, the what do I do next? Like, what questions should I ask? Getting a second opinion, right? All of that. So those are my 2 favorite organizations that are amazingly run and provide such support from beginning diagnosis through treatment. Again, also to caregivers as well.
Yep. And then I will add a third resource is, and again, people are from all over the world. You can be in a rural situation where there's one hospital 3 hours away, or you can be in an urban center where you've got 5 hospitals and 50 physicians to pick from, So, but most places will have a cancer nurse navigator, or at least somebody that knows the organization, or just ask for one of those if you automatically don't get one, because that person can help you navigate, because that's why they exist. Cancer is complicated. Testing is complicated. Surgery, chemotherapy, and radiation are all really complicated. So if you don't have a cancer nurse navigator, ask for one, and they can probably set you up with somebody that's specific to your institution. Again, that should be free. That kind of helps you understand and navigate. Where do I go next? What does this test mean? What is the result? What am I going to do with this? What is this physician for? So there are people out there to ask questions of, and I think that's a nice resource as well. And again, I think people, I like how you say, drop the self-stigma. And then also remember too, that anxiety is completely normal. A little bit of depression is normal. Fear is normal. Letting your brain go to worst case scenarios is normal. You can't not thinking about it's not going to make it better. And worrying about things isn't going to, you're not thinking about bad case scenarios does not make them more likely to happen. But again, but if you are really, you're not able to go to work, you're not able to enjoy your family, you can't take care of your kids, or this has been going on for 2 to 3 weeks, then it's that's getting to a point where it's not safe for you anymore. So then I would call your primary care physician and say, listen, or even your medical oncologist, say, okay, I'm really struggling. I can't sleep. I have anxiety. I can't eat. I can't function. Then it is absolutely okay to lean on medications, medications to make you less anxious, medications to help you sleep. This is, again, it feels like it's going to be forever, but most cancers, even if they're long, they are a temporary situation. And I don't want to minimize it. But so, yes, you can take pain medications. Yes, you can take sleeping medication or anxiety medication, because from point A to point B, you can be miserable or less miserable. And if medications and things like that help you, or a therapist or a navigator or a mentor can help you be less miserable, hello, let's do that. Point A to point B. Your risk for recurrence is going to be the same, but how miserable you are to some degree, you can minimize that. So don't worry about taking it. Nobody wants to take medication, but there are times and places for them, and your physicians are not going to let you get addicted. So, and
thank you for saying that. I think that's so important.
Yeah, you don't have to worry about it. If you have a history of addiction, there are still medications that your physicians are experts in that. They know what is okay and not okay. So go ahead and lean on that left and right if you need to. There is nobody is gonna fault you for that at all. So
Exactly.
that's
Exactly.
really
This is
cool
not
stuff.
an easy, yeah. I mean, when you're navigating any emotional situation or any trauma, this is a trauma. And
It's a
this,
drama.
like, the cancer word alone is a trauma. It doesn't
Yep.
matter, what type it's a trauma. And so,
Yep.
when our bodies go again into that fight or flight, into that, shutdown or depressive state, and we can't get out of it,
Yep.
yes, absolutely reach out for help. And again, the shame of taking medicine or the stigma of talking to someone should be gone from our world,
Right.
right? Like, go away. That holds people back from getting help when they should get help.
Yep.
So thank you
Yep.
for saying that, for
Yep.
sure.
Yep. Well, Jeanette, this has been absolutely fantastic. I really appreciate you being here and sharing your expertise with us. And I do hope that this is taken to heart. And again, if you are newly diagnosed with cancer, take a breath. You're going to be okay. We'll get you through it. And if you are somebody who's out, again, this is still good to hear. And if you have your suggestions, please put them in the comment section. I'd love to hear your tips for newly diagnosed people. And if you have a family member, a friend, or coworker who is going through a new diagnosis, again, feel free to share these resources with them. So, all right, Jeanette, thank you so much. And thank you, everyone, for joining us
Thank
here
you.
on the Recovery Room podcast. Stay safe, exercise like your life depends on it, because it does. And we will talk soon. Thanks, everyone.
Bye.
I love having you in my listener community. So if you haven't already, please follow and subscribe to The Recovery Room on YouTube and on Facebook, and to the Recovery Room podcast. Please share these wonderful free resources with your support groups, family, friends, and even your medical teams. I also have an incredible cancer survivor community membership group called Recovery Room Plus. I'd love for you to consider joining. In Recovery Room Plus, you get direct interaction with me, in-depth cancer recovery info and experts, and really cool live events like yoga, book discussions, cooking demos, member meets, and much more. I would love to connect with you. You can learn more at recoveryroomplus.com. The link is in the show notes. For your episode recap, yes, when it comes to a cancer diagnosis, amp up your self-care. Put yourself first. Don't expect yourself to be perfect. Be selfish. Lean on your village. Do all these things to help you cope with the pending intense difficulty, because you can't go around it. Licensed clinical social worker Jeanette Boss's recommendations for resources for a new diagnosis are cancer.org, the American Cancer Society website for information and for support. Immerman's Angels, and After Breast Cancer Diagnosis for peer-to-peer support. I have worked with all three of these resources and fully support the recommendation. I'm Dr. Leslie Walke, signing out from the Recovery Room podcast. Remember, you are the most important person on this planet, so please care for yourself that way. We'll talk again soon.